name is Sally Odunga, and as I had said, I'm a research officer at FHRC, but I'm an economist by training. So before I begin, I want to tell you a story. Do you love stories? I come from a family of an employed parent and a stay-at-home parent. Guess the gender of the stay-at-home parent? Whoever gets it right will get a gift at the end of the presentation. Who is the stay-at-home parent? Okay, let's proceed. Now, my presentation will be around what accounts for women's equitable or inequitable career paths in the health sector in Kenya. As Dr. Sylvia had indicated, this study was conducted in Kenya and India, but I'll focus my presentation in Kenya. So I'm going to begin. My presentation will follow will have the following structure. We have a background, methods, results, and then recommendations. So why was the scoping review conducted? This was also initially indicated. There's underrepresentation of women in leadership in the health workforce. And given this is a problem, there's still limited evidence on the extent of this problem, especially in low and middle income countries. And in this context, we are referring to Kenya. And why is this significant? It is significant because we want to inform stakeholders. And I remember when we were having conversation yesterday, who are these stakeholders? Maybe we'll determine that at the end of the presentation. Whom do we want to inform? So we want to inform stakeholders to develop evidence-based solutions. We don't want interventions that are not anchored around evidence, so that we know what is the problem, what works, what doesn't work. So when interventions are developed, then they're able to achieve the needed objective. Then we are saying that we need them to identify what works, what doesn't work, based on the evidence that we are going to present, and so that we are able to achieve gender equality and equity in Kenya's health workforce. So how was the scoping review conducted? We searched through various databases. In total, there are about 5. And so that means this was a comprehensive search. And then you can see we are indicating what was our inclusion criteria. We were open from 2000 to 2022, sorry, and we looked at peer-reviewed literature as well as grey literature. The reason why we included both peer-reviewed and grey literature is because we realized that there are very limited studies, of course, and that's why we had to include all the available literature that were focusing on this particular issue that we are looking at. And we're focusing on paid formal health professionals in Kenya. Then another key thing that we're looking at when searching for these articles was that we wanted articles that factored in women's representation or leadership in terms of the barriers and the facilitators. So we did the screening. As you can see the figure, so this is my right or left, I'm not sure, that side. So you can see from that side, that is the process that we took. And then we did some screening. We did title, abstract, full text. I know researchers might relate. Those who cannot relate, itabidi tuelewe tu leo. So that we did title, abstract, and full text. And of all the articles that we were able to screen, only 11 met our inclusion criteria. So this also indicates what we are trying to say. There's limited evidence. And of the 11, four of them were the ones that were talking about women in leadership in general. So the remaining 7 were talking about the nursing profession. And as we indicated as well, for the nursing profession, we realized that existing evidence shows that a majority of nurses are women. So we felt the need to include such kind of literature because we believe that if we present this evidence as well, it should be able to inform interventions that are geared towards also helping nurses to progress in their careers. So in terms of synthesis of results, how we've presented our results, we used the socio-ecological model. And this model, the good thing about it is that it considers various factors. As we realize that for a woman to be able to progress in their careers, it takes several things to be factored in at the individual level, organizational level, structural level, as well as normative. So this is the rationale why we use this particular model. It also looks at the interaction between a person and the environment, and it also acknowledges the intersecting identities and experiences. So I'll begin my presentation with the individual or interpersonal factors. And the good thing about my presentation, I'm not going to focus only on the negative things. I know you're wondering, what is the good thing? So we want to also look at the good things, what people can be able to adopt. So when I'm looking at a particular factor, I look at it as an enabler as well as a barrier, so that you are able to pick on what works, what will not work. And for this particular factor, if you're a woman leader, I think we need to reflect more on this, so that we don't keep on saying that we need support in this. There are things that we as women can do it on our own, especially for the individual bit of it. Now, when I start with the family support, so the women were saying that what enables them to progress in their careers is the support and encouragement from spouses and parents. How are you, husbands who are in the room? You are fine? Do you support your women? Okay, so we are saying, this is what women are saying. So if you're a husband here, you know, if you want your woman to be able to progress well in their career, they need that support from you. And so we are saying for those who do not have them, you can get that support from your parents. So we are saying also parents can provide that support to a woman to be able to progress in their careers. And when we're also looking at a family support as a barrier, we are saying that when you have family and parental obligations, it becomes a challenge sometimes, because now you have to decide on what we are supposed to do. In terms of advancing education and taking certain jobs, you have to choose sometimes, and it becomes difficult. So if you don't have good family support, then it becomes a barrier for you as well. Then the issue of personal attributes. So in terms of personal attributes being an enabler, we are saying self-discipline. So this is something that we should do reflection as women. So do you have self-discipline? Do you have determination? Do you want even to be a leader, first of all? It cannot be given to you if you are not even prepared to be a leader. So you need to be determined. You need to be passionate. You need to be committed. You need to be ambitious. And you need to have mentors and role models. So these are things that you can do on your own as a woman and be able to compete. I know it becomes quite difficult sometimes, but we just have to do this because this is how things are. Then in terms of nurses and leaders, this is a particular attribute that the nurses were able to report. So for them, they were saying to be able to progress in their nursing career, they're supposed to have leadership-like attributes, which means they need to have management skills, negotiation skills, problem-solving skills, as well as effective interpersonal skills. Then this one, if you look at it as a barrier, it was mentioned that lack of confidence really plays a role in some women not being able to progress in their careers. So whatever it's needed, please try and be able to have that confidence so that you are able to be seen. Of course, confidence also increases your visibility as far as what you are able to do and what you are not able to do as a woman. Then when we look at knowledge and skills, we have enablers. So for this particular, for nurses and leaders, they mentioned that in order for them to progress and be involved with even health policy formulation, they need to be knowledgeable about health policy formulation and be competent in their field of nursing so that they're involved in these decision-making tables. And if you look at it as a barrier as well, the nurses mentioned that lack of confidence, so you can see lack of confidence is a key issue, and then lack of active participation. So you are brought here today, and you keep quiet the whole day, and nobody notices that you are here. You see? So lack of active participation when involved in policy making, lack of experience and knowledge pertaining to the health policy development process, and lack of tertiary education to be able to progress in their careers. Then last but not least, as far as the individual and interpersonal factors are concerned, we have material resources. And here women mentioned that financial constraints becomes a key issue for them because they have parental obligations and they prioritize their children's education compared to theirs. So that is a woman for you. I don't know if men also do this, that if they want to progress with their careers or with education, they're like, I have a child. Maybe I should focus on the child first, then I'll proceed with my education later. But for women, it's something that is coming out, that when they have children who needs to go to school and they also want to further their education, they first consider their children before they're considering themselves. And for me, I think this is now a challenge because maybe it's the soft part of women. I don't know. That is the bitter truth, but it's so unfortunate. So some women have to prioritize their children's education. Then we have the organizational factors. So for organizational factors, some of the key things that were mentioned were capacity building and networking, career progression and leadership opportunities, organizational policies, work culture and relationships, as well as flexibility and work burden. So for the organizational bit, now this is the role of the organization, what they can be able to do as institutions. So one of the enablers we've said is capacity building. We're talking about continuous professional development. This includes on-the-job training, scholarships to further education, workplace mentors, and we are saying that this is a structured kind of mentorship, that the organization has some structured mentorship where women are able to be mentored, and also having supportive supervisors who recognizes your ability and who is able to encourage you to advance in your career. Then when you look at nurses and nurse leaders, what they were trying to mention was that they're saying that if there's a broadened curriculum, as I said, I'm not a nurse, so I'm not able to confirm what they're trained about. But they mentioned that if the curriculum is broadened so that it's able to cover health policy, then they're able to support policy development as well. They felt that because they're not knowledgeable about health policy formulation, it's become so difficult when they're invited, and when they're invited in such forums. So they're not able to contribute much. And as you know, if you don't contribute much, nobody will be able to recognize you. Then you'll go back like that, and then you'll not even grow. Then we look at the barriers. So barriers, the nurse leaders mentioned that sometimes the institutions have financial constraints for capacity building programs. So because of financial constraints, some of them are not able to get these opportunities to develop. And of course, this now acts as a barrier as well. Also, they mentioned that their curricular failure to cover content related to health policy formulation makes it difficult for them to participate in the policy development process, which they are saying that if they are able to engage in such forums in the policy development process, then they are able to contribute on what works for them, and they're able to progress in their careers. Then on the organizational policies, so this one was just a barrier, not a facilitator. And what was commonly mentioned was that their inability to become in charges or managers for rural hospitals, since current policy allows for clinical officers to assume that role. Maybe at the end of the discussion, we'll have a discussion with the nurses who are here to let us know how true or false this is. But according to them, they felt like they have the required education, they have the relevant experience, but they're unable to take up certain roles because of how the systems are structured and the policies that are there. And they feel like they're even more qualified than clinical officers at some point, and they are the ones who are given this managerial role. So for them, they feel that this is a barrier to them. Then we're talking about work culture, relationships, and harassment. So as an enabler, the nurses or leaders said that some level of decision-making autonomy enables them to exercise leadership. And also it allows them to participate in all stages of health policy-making process. And this one as a barrier, they mentioned that sometimes they can be leaders, but they also do not have the decision-making autonomy. So you're just a leader but you don't have that power to make certain decisions. And they feel that if you don't have that power, then it's so difficult for you to also progress in your career. And then, as I had mentioned earlier as well, so sometimes they have difficulty in engaging in health policy development process due to lack of opportunity or forums, and even support from institutions, as well as recognition of efforts. So we are also saying here that it is important, if you are an employer here or you are a manager here, recognize the efforts of those who are doing good work. So if there's a woman in your team and you understand that they're doing a good job, please highlight those qualities so that they're able to get confident, they're able to get the visibility that is needed for them to be able to progress in their careers. Then, flexibility and work burden. You can see my picture there. That is how it looks like sometimes for women. You have to strain. You have work, you have your family, and you are saying that work environment that enables balancing of family, career, and further studies enables women to progress in their careers. They also said that workplaces that provide study leave, enabling women to further their studies while keeping their jobs, also enables them to be able to progress in their careers. Now, in terms of barriers for this particular attribute, the nurse leaders mentioned that time constraints sometimes limits them to be able to progress in their careers because, as we all know, nurses and doctors their role is quite complicated. So so when it comes to being able to go to school as well as perform their work, it becomes difficult. So it hinders them from progressing with their academics. So ultimately also focuses on the ability to progress in their careers. Then in terms of the structural factors, so we have government policies as well as access to public infrastructure. And here the nurses said that functioning legislative structures ensured a higher representation of national nurse leaders in policy development at all stages. So it's not all bad. I'm here to say that it's not all bad. Sometimes because of these policies, which are good as well, it enables these women nurse leaders to be able to be involved in the policy making process. Then we have access to public infrastructure. This one was mentioned by everyone, and this one was that lack of necessary equipment to do your job can also act as a barrier for you to be able to progress in your career because you don't have the necessary tools to be able to show that you are competent enough. And then poor transport to the workplace, lack of access to good schools for children. This was quite interesting because, as I'm also saying, women are the ones who are concerned with things mostly related to their children. For example, there's an excerpt that was saying that as long as the place that I'm going to work does not have a good school, I'd rather remain where I'm working, regardless of whether I'm going to get an increment in my pay, because they need their children to have good schools, good environment to study in, so they have to choose the welfare of their children over theirs. So if they're promoted, for example, you're promoted to go work in Turkana. I'm not saying Turkana is bad. This is an example. So for example, you are promoted to go and work there, and maybe the environment is not conducive there for your children to be able to go to school. So you compare it, and maybe there where you're going to get that promotion, you're going to get more pay and everything. But then you compare with where you are, and you are like, if my children are getting a good education here, I'd rather remain here as compared to going there. So they sacrifice their careers over certain things that needs to be taken into consideration. And then also the issue of limited access to safe water, lack of suitable housing. You know, sometimes it makes them leave their jobs or even decide to not take up new jobs or new promotion, as long as the environment that they're going will not be favorable to their children. Then, last but not least, we have cross-cutting gender normative norms. And this one we have now gendered occupational segregation. So according to nurse leaders, they mention that medical doctors and clinical officers were often preferentially selected for leadership positions, even when the nurses have relevant qualifications because of hierarchy issues in health. Then we have unpaid care work burden, and it was interesting to, from one of the excerpts where an employer said that, you know, sometimes it's so difficult to employ a woman who is pregnant, because now if you give them a managerial position, how will they be able to manage their work as well as the family? So for them, they feel like during recruitment, that will not be a favorable way of doing things. So, so this also a challenge during recruitment process. Then last, we have pregnancy as a key reason why Kenyan student nurses drop out from training, rendering them unable to secure good employment. And we know when pregnancy occurs, highly likely, not highly likely, most likely, that a woman who is the one who is now pregnant will be the one to drop out of the school, not the one who impregnated that particular student. So, so when you impregnate this student, the lady drops out of school, you continue with your training, which means by the time she goes back to school, that is if she decides to go back to school, you'll already have progressed in your career, so it becomes so difficult to compete with your counterpart that you began with. So after talking about the barriers and facilitators, we were also looking at the interventions that have been conducted, so that you can see what are the model interventions that can be adopted, so that we can see more women progressing in their careers. Interesting enough, based on the search that we did, we were only able to find one study that talked about an intervention. And this study, it looked at, there was an intervention that involved Kenya women doctors, where they were trained internationally on research. And the training was short-term and long-term, and the training was in epidemiology, biostatistics, biomedical research. The effect of intervention was not evaluated, unfortunately, which also, this seems like a gap, because when we implement an intervention, we would like it to be evaluated so that you can see whether there's an effect. Is it a positive or a negative effect? And if it's a positive effect, then how can it be adopted, or how can it be scaled up? So while the intervention was not evaluated, but the participants also mentioned that after completion of the program, they were able to take different career paths as well. So there were Kenya medical women doctors at the time of training, but at the end of the training, they were able to see there were other career paths that they could take apart from being doctors. So some of them decided to go and teach, some of them ventured into research, others engaged in other lucrative careers. So I know I've talked a lot and you might forget what I've said, but please remember this slide alone. So in terms of recommendations, as you said, we are saying there's limited evidence. There's no doubt about that. We've provided evidence. We've said that what we've been able to find is that there were only 11 papers. So on what works to achieve inclusive and equitable career progression for women in the health sector in Kenya. So this shows there's need, of course, to have more research conducted that reflects on what works for women. And also, if there's any other work that you are doing as a stakeholder and you've not documented it, it becomes so difficult for people to be able to know what you are doing. Because based on what we were looking at evidence that was online. Maybe we are doing even a good job, but we are not making it visible. So we are not able to get that. And when people are not able to know what we are doing, then sometimes it does not make the impact that we intended it to do. Then the second thing that we are saying is that addressing power imbalances between nurses and doctors is key to enabling more women to take up leadership roles. We are saying this because, as you had indicated, about 70% of the workforce are nurses, and most of the nurses are women. So if there's power imbalance, then it means that more women are not able to take up leadership roles. So if this power imbalance is able to be addressed, then you can be able to have more women in the leadership roles. Then interventions to transform gender norms. Of course, this is very key as well, where we have equal opportunities for women career advancement. Then Number 4, we are also saying that developing and enforcing gender equitable laws and policies are crucial, actually very crucial, to enabling women's career progression. Last but not least, the one that are highlighted in red, read it again. We are saying career equity and leadership diversity can only be realized through action across multiple intersecting domains. I'm going to read it again. Career equity and leadership diversity can only be realized through action across multiple intersecting domains. We are saying that you cannot just use one approach. It has to be multisectoral. We are looking at it from the individual perspective, organizational perspective, structural perspective, as well as the normative perspective. Thank you for that, and I would like to acknowledge the project team members, as well as Global Health 50/50, International Center for Research on Women, India, as well as Bill and Melinda Gates Foundation. Thank you.